Hi everyone, my name is Ryan. I'm one of the vets from the Small Animal Surgery Department here in University of Queensland in the Gatton campus. This video here we're going to do today is aimed at the 4th year vet students to demonstrate to you guys how to put on your surgical gown and your surgical gloves. So before we get to the stage of doing the gowning and gloving techniques, you should already be in your surgical cap, surgical mask, and appropriate boot covers as well, as you can see over here. Okay, so over here on this table, we just got 3 items here laid out. They're all individually packed in a sterile packaging. You've got your surgical gown here, followed by 2 pairs of gloves. I've got 2 pairs of gloves here because I typically would double glove when I'm performing any orthopedic or neurosurgery. I will be playing the role as the surgeon who have just completed our aseptic hand scrub technique. So we will approach the sterile field over here. You gotta keep your hands high up so that you don't put it anywhere close towards your scrub top, because your scrub top obviously is not sterile. There should be a couple of hand towels in there in the sterile field if you have a look in there. So all you gotta do is reach over, grab one of these hand towels, and each of these hand towels is meant for you to dry each palm. So you're just gonna drop it and just clean and dry every finger, the palm, and always move from the most sterile field to the least sterile part of your hand. Once you reach the elbow, just simply drop. And you do the same with the other hand towel as well. Pick that up. And now do the exact same thing with the other hand. It doesn't matter whether you do the left or the right hand first, so long as you remember to always clean the most sterile part of your hand down to the least sterile part. Once you get to that level of the elbow, just drop. Keep your hands upright at all times. So now we're ready to do the gowning. And you can see these individually packed gowns are designed in such a way you should be able to pick it up and able to don the gown in a very sterile manner. So just pick the gown up and see how the way it's folded. There should be a little pocket on one side and a little pocket on the other side as well. Now this pocket allows me to slide my palm into each of these sleeves, right? And that's where I'm going to be putting my hands into each of these sleeves on the left and the right side. Now what I want to do is to make sure I don't drop the gown here because there are non-sterile part of the table. I'm going to take a couple of steps backwards, right? And with my hand on either side of the pocket, I'm going to just drop the gown. And I should be able to slide my hand left and right side into the sleeve. Once I do that, I'm going to keep my hands within the cuff of the surgical gown so that I do not expose any finger out here. Keep it close towards you, and the surgical nurse will come and start dressing me up, starting with the Velcro around my neck up the top. So the parts of the gown that the nurse is touching is the non-sterile part of the gown, and then there's the drawstring on the inside as well. He or she will let me know once the internal string has been tightened. Done. Thank you. So I approach my sterile field again. So obviously, in this situation, I'm going to be double gloving. So we're going to practice 2 different types of hand gloving technique. The first one is called the close gloving technique. We're going to put these pair of gloves on with our hands all within the cuff of the sterile surgical gown. So we're going to grab that underglove. Obviously, you would have the appropriately sized one. So rather than have the glove placed this way, I have it placed in the opposite direction facing me, so that right is on the left, left is on the right. Open up this packet. I'm going to start off by picking up the left glove. So obviously the left glove is now on my right hand side. I'm going to pick it up with my left hand. Pick it up like this. I'll flip it around. With my right hand still within the cuff, I will grab this little folded end here and just simply wrap it over my finger. Okay? But do it a little bit slower on the other side. So you can see right now, I've got my hand in my glove and the cuff sitting halfway through the glove over here. So I'll do the exact same thing on the right side with my right hand. I'm going to be picking up the glove as such, and you still see I do not have any fingers exposed. With my other hand, I'm going to grab this part of the glove, wrap it around the glove. So at no times would you see any skin being exposed. Okay? Once that's done, that's your under glove here. You can see there's a lot of crease around the tips of the glove. Just adjust it and make sure your gown sleeve do not all get crumpled underneath the under glove as well. All right? Same thing, do it on the other side. And once that's done, your close gloving technique for the under glove has been completed. As you can see, the entire procedure has been done without any skin being exposed. Now we have the under glove to put on. Sorry, the over glove, my mistake, the over glove to put on. And to put this over glove on, we don't have to do the close gloving technique, right? Because you already have a pair of sterile gloves on by this stage. So to do the over glove, we can simply put it on as though this is an open glove technique, okay? So there's no need to turn the glove in the opposite direction, just put it as per where it is. Left on the left, right on the right. You open up the wrapper. Pick this glove on the right hand side up with your left hand and simply slide your right hand into this pair of gloves. And then on the opposite side, we'll pick up the glove from over the cuff like this and just simply slide my left hand into this glove here. And all that's left to do after this is to adjust the cuff of the outer glove. Now, we're not quite done yet because there's still one last step, right? You can see in front of me, in front of the sterile gown, there is the last bit of string that needs to go around the gown. Now, you can see there's a cardboard here attached to the string here. You've got a white bit and a colored bit. You will be holding the white bit with your right hand. With your left hand, you want to pull this drawstring out of the cardboard. Now, you're going to hand the colored bit of the card to the surgical nurse, and you're going to spin around and grab the string, and the surgical nurse will pull the cardboard away from me. That's it. And what we've got left is just to put a knot in here. And at this point in time, that should conclude our gloving and gowning technique.